Good morning/afternoon, everyone. Welcome to our presentation on alcohol use disorders, effects, and complications. Today, we'll be diving into the spectrum of alcohol use disorders, exploring how alcohol misuse impacts different body systems and the various serious complications that can develop. We'll look closely at the medical, psychological, and social consequences of heavy drinking, along with the physical dependence it creates and the withdrawal symptoms that often follow. My goal is to help us all gain a clearer understanding of how pervasive alcohol's effects are, as well as the challenges faced in diagnosing and treating these conditions. I'm excited to share this important information with you on behalf of DSM Toolbox Inc. Here we have an overview of the spectrum of alcohol use, which varies widely from occasional social drinking to more severe levels of misuse and addiction. It's important to understand that alcohol consumption is influenced by both neurological factors, like the brain's release of endogenous opioids that create feelings of pleasure, and psychosocial reasons, such as the desire to experience euphoria, manage stress, or avoid withdrawal symptoms. However, when alcohol use becomes heavy or chronic, it poses serious health risks and significantly increases the likelihood of premature death. This sets a foundation for us to explore the complexities of alcohol use and its consequences in more detail. Alcohol use disorder, or AUD, covers a broad range of drinking behaviors that can lead to many different challenges, whether medical, social, legal, interpersonal, or work-related. People with AUD might drink just occasionally, sometimes heavily, or in unpredictable ways, and they often have difficulty controlling their drinking. This disorder isn't just about severe addiction. It exists on a spectrum. On the milder end, you might see weekend or social drinking that still causes problems, while the more severe end includes physical dependence and serious health consequences. The diagnosis relies on criteria from the DSM-5, which recognizes that AUD isn't a fixed state but a continuum. People can move through heavier use, periods of abstinence, or misuse. It's important to realize that someone with AUD might not fit the typical image of alcoholism, but their struggles are real and significant. The image here helps to illustrate how the spectrum unfolds, highlighting the range of severity and impact AUD can have. On this slide, we see a comprehensive overview of alcohol use and its impact both globally and in the United States. Starting with the global perspective, Europeans are identified as the heaviest drinkers worldwide, which has significant public health implications. In Africa, although overall consumption might be lower, the proportion of deaths related to alcohol is notably high, reflecting the severe impact of alcohol-related harm in that region. Globally, alcohol contributes to about 6% of all deaths, equating to roughly 3 million fatalities each year. Turning to the United States, the data reveal that 80% of individuals aged 12 and older have consumed alcohol at some point, and about half have used alcohol in the past month. Among those who drink, 45% engage in binge drinking, and 30% are considered heavy drinkers, indicating risky drinking behaviors are quite common. This is further emphasized by the prevalence of alcohol use disorders, with 7.3% of adults experiencing mild disorder, 3.2% moderate, and 3.4% severe. These figures highlight that alcohol misuse is widespread and that it affects people at varying levels of severity. Understanding these patterns is crucial for designing effective public health strategies and raising awareness about the importance of monitoring alcohol consumption over time. Here we have an overview of the different subtypes and characteristics of individuals with alcohol use disorder, or AUD. The largest group, making up 68% of the sample, is labeled non-problematic. These individuals typically have a low tendency to exceed alcohol limits and may have a family history of alcohol use, but their behavior doesn't generally lead to significant issues. Moving on, the moderate group represents about 25.6% and is often composed of men aged 20 to 40. This group often includes smokers and individuals who engage in gambling and cannabis use. They tend to drink beyond their intended limits but usually show low levels of treatment seeking. The severe subtype, comprising 5.4%, is characterized by more complex problems. They are more likely to experience opioid use and major depressive disorder, and often tend to be separated or divorced. Hazardous drinking is common, and like the moderate group, treatment seeking remains low. Finally, the extreme subtype, though only 1% of individuals, presents the most concerning profile. This group has a history of suicide attempts, smoking, gambling, depression, and tranquilizer use, with a very high probability of meeting all AUD criteria. Overall, these subtypes vary by severity, comorbidities, age, gender, and treatment-seeking behavior. Understanding these distinct profiles allows us to better tailor interventions and treatment strategies to meet the specific needs of each group. Here, we're looking at three important concepts related to alcohol use disorder: physical dependence, tolerance, and craving. First, tolerance happens when the body gets used to having alcohol regularly, meaning a person needs to drink more to feel the same effects. This process is affected by both how much and how often someone drinks, as well as their genetic makeup. Interestingly, reverse tolerance can also occur, especially with aging or liver damage, where even smaller amounts of alcohol can cause intoxication. Then we have psychological craving, which is the mental and emotional urge to drink. This craving often arises as a way to manage stress or seek relaxation, and it can strongly drive someone to continue drinking despite the negative impacts it may have. The image on the left helps illustrate these ideas, giving a more tangible understanding of how these factors interact in alcohol use disorder. Chronic alcohol use has a profound impact on the digestive system, starting with nutrient absorption. Heavy drinking interferes with the body's ability to absorb essential nutrients, partly due to alcohol-induced diarrhea and other related factors, which often leads to malnutrition and vitamin deficiencies. This can severely compromise overall health. Additionally, about 10% of heavy drinkers develop pancreatitis, a painful and potentially serious inflammation of the pancreas. Alcohol misuse is also linked to increased risks of cancers, particularly in the oral cavity, liver, stomach, and other digestive organs. Beyond these conditions, chronic alcohol consumption can cause gastrointestinal damage, including perforations in the digestive tract, and it disrupts the delicate balance of the gut microbiome. This imbalance further impairs digestion and overall health. Importantly, digestive diseases caused by alcohol contribute to over 1/5 of alcohol-related deaths worldwide, highlighting the serious and often fatal consequences of alcohol's impact on digestive health. Understanding these complications is crucial for recognizing the full extent of harm chronic alcohol use can cause to the digestive system. Let's begin with fatty liver, which is the earliest stage of alcohol-related liver damage. When someone drinks heavily, the liver starts to enlarge and accumulates fat. This condition can develop very quickly, sometimes within just a few days. The good news is that fatty liver is reversible if the person stops drinking early enough. If heavy drinking continues, the liver moves into a more severe stage called alcoholic hepatitis. Here, inflammation sets in, liver cells begin to die, and collagen builds up. This not only damages the liver further, but also raises the risk of death, so it's a critical point in disease progression. Next, alcoholic hepatitis can lead to cirrhosis. At this stage, scar tissue replaces healthy liver cells, which significantly impairs the liver's ability to function. Cirrhosis brings serious complications and represents advanced liver disease. Finally, in the most severe cases, complications like portal hypertension develop. This causes increased pressure in the veins, leading to esophageal varices, dilated veins that can rupture and cause life-threatening bleeding. Additionally, people with advanced liver disease face higher risks of liver cancer and death. This progression underscores the importance of early intervention to prevent irreversible damage. Chronic alcohol use has profound effects on both the circulatory and central nervous systems. Starting with the heart and circulatory system, alcohol acts as a cardiotoxin, which means it damages the heart muscle and weakens other muscle tissues. This damage significantly raises the risk of developing coronary heart disease, high blood pressure, stroke, and a condition called cardiomyopathy, which is a serious heart muscle disease and a major contributor to heart failure in heavy drinkers. Moving to the central nervous system, heavy drinking impairs brain function in several critical areas. It causes memory deficits and disrupts neurological function by damaging key regions like the prefrontal cortex, responsible for decision-making and executive functions, and the cerebellum, which controls coordination and balance. A common and worrying symptom is alcohol-induced blackouts, or amnesia, where people temporarily lose memory of events. It's important to note that genetics can influence how susceptible someone is to these effects. Overall, these harmful impacts on the heart and brain show how chronic alcohol use compromises both physical health and cognitive abilities, affecting a person's overall functioning and quality of life. Chronic heavy alcohol use can lead to significant neurological damage, especially affecting memory and cognitive functions. One of the most striking effects are blackouts, where individuals appear conscious but later cannot recall what happened during those intoxicated periods. When it comes to alcohol-induced dementia, several theories exist. The damage may result directly from the toxic effects of alcohol on the brain, from vitamin deficiencies, particularly of thiamine, or from liver damage that allows toxins to build up and affect brain function. A particularly serious condition related to this is Wernicke-Korsakoff syndrome, which is caused by a severe deficiency of thiamine or vitamin B1. This syndrome manifests with symptoms such as ataxia, which affects coordination, changes in mental status, and eye movement abnormalities. Wernicke-Korsakoff syndrome requires prompt diagnosis and immediate intravenous thiamine treatment to prevent lasting brain damage and to reduce the risk of death. Recognizing these symptoms early and intervening quickly is essential in managing the neurological consequences of chronic alcohol use. Here we see how alcohol impacts both sleep and the peripheral nervous system in a continuous cycle. First, chronic alcohol use disrupts the normal sleep cycle by making it harder to fall asleep and reducing the quality of sleep. It suppresses REM sleep, which is essential for memory and cognitive functions. When someone stops drinking, this suppression leads to REM rebound, where intense and vivid dreams occur, sometimes triggering relapse. Next, even after quitting alcohol, many individuals experience long-term sleep disturbances, like persistent insomnia and disturbing dreams, which can last for 1 to 2 years, making recovery more challenging. Finally, we have peripheral neuropathy, a serious condition common in heavy drinkers, causing weakness, pain, burning sensations, and sensory loss. This condition is linked to chronic alcohol exposure, genetic factors, and depletion of B vitamins, affecting mobility and quality of life. Recognizing these interconnected effects is crucial in supporting long-term recovery and managing complications from alcohol use. Here, we're looking at the psychiatric effects of alcohol use disorders. First, chronic alcohol misuse often leads to high rates of both depression and anxiety. This can make diagnosis tricky because symptoms of anxiety and depression can overlap with those of alcohol withdrawal. In fact, anxiety symptoms may persist for months even after someone stops drinking, which complicates treatment and recovery. On the other hand, individuals with alcohol use disorders also face a significantly increased risk of suicide. Alcohol can act as a disinhibitor, which means it lowers a person's self-control and heightens impulsivity. This effect is especially dangerous for vulnerable individuals, increasing the likelihood of suicidal behavior. Overall, these psychiatric complications not only impact diagnosis and treatment, but also raise the risk of relapse, making it crucial to address both the mental health and substance use aspects in care. When we look at the effects of alcohol use beyond the brain and liver, the respiratory system is significantly affected. Chronic alcohol use can lead to sleep apnea, increase the risk of pneumonia, and weaken the lungs' natural defenses, making respiratory health much more vulnerable. Moving to sexual and bone health, alcohol misuse often causes sexual dysfunction and results in calcium loss, which weakens bones and raises the likelihood of injuries. Finally, alcohol's impact extends to various other systemic effects. It's a major factor in motor vehicle deaths and home injuries. It also contributes to gum disease, delays wound healing, and increases the risk of hypothermia. Altogether, these points highlight the widespread and serious consequences of alcohol on multiple body systems, emphasizing just how important it is to understand its broad impact on overall health. Here, we're looking at the increased risk of prescription medication abuse among individuals with alcohol use disorders. People struggling with alcohol use are about 18 times more likely to misuse prescription drugs, especially benzodiazepines and stimulants. This is a critical point because it highlights how alcohol dependence can lead to misuse of other substances. Now, focusing on benzodiazepines, these drugs act on the central nervous system in a way that's very similar to alcohol. They affect the same neural chloride channels, basically substituting for alcohol in the brain. This similarity means that when benzodiazepines are combined with alcohol, the risk of accidental overdose rises significantly, and in some cases, it can be fatal. This connection underscores the importance of careful monitoring and intervention for those with alcohol use disorders who are prescribed these medications. It's essential to manage these risks to prevent harmful and potentially deadly consequences. Alcohol withdrawal syndrome usually begins between 6 to 24 hours after the last drink. At this initial stage, people often experience symptoms like agitation, anxiety, tremors, and nausea. These symptoms can be quite distressing, but generally subside within 2 to 3 days if the case is mild. However, around 8 to 12 hours after the last drink, the situation can become more severe. Hallucinations may appear, along with high fever, sepsis, and cardiac arrhythmias. There's also an increased risk of withdrawal seizures during this period, which makes medical supervision critical. Then, between 1 and 5 days after the last drink, the most dangerous phase can develop, delirium tremens, or DTs. This is marked by profound delirium, vivid hallucinations, high fever, and carries a risk of death if not treated promptly. DTs is a medical emergency and requires immediate intervention. Throughout this entire timeline, using the CYR scale helps clinicians evaluate the severity of symptoms and make informed decisions about the necessary treatments. Recognizing these stages early is essential to manage withdrawals safely and effectively. Here we see an overview of the extended symptoms that often persist long after someone stops drinking alcohol. Issues like anxiety, difficulty sleeping, and strong cravings can last for weeks or even months, making it really challenging for individuals to maintain abstinence. The chart breaks down the main diagnostic categories according to the DSM-5 TR. The largest portion, 50%, falls under alcohol use disorder, which now combines what used to be separate categories of abuse and dependence into a spectrum. Following that, we have alcohol intoxication at 20%, withdrawal symptoms at 15%, alcohol-induced mental disorders at 10%, and other unspecified alcohol-related disorders making up the remaining 5%. This visualization helps us understand not only the prevalence of each category, but also underscores the clinical importance of recognizing prolonged withdrawal symptoms during treatment and recovery. To summarize, chronic alcohol use has significant neurotoxic effects, severely impacting brain function and leading to cognitive decline. Alcohol use disorder exists on a spectrum, meaning it affects individuals in diverse ways without a typical profile. As dependence develops, withdrawal symptoms can range from uncomfortable to potentially life-threatening, which poses serious treatment challenges. Beyond the brain, alcohol causes systemic damage to multiple organs, including the liver, digestive system, and circulatory system, increasing the risk of serious health complications. Lastly, ongoing research is crucial as it continues to uncover the mechanisms behind this damage and works toward improving management and recovery for individuals struggling with AUD. These interconnected aspects highlight the complexity of alcohol's impact and the importance of a comprehensive approach to treatment.